Your doctor has recommended that your prostate be treated with a TURP, or a transurethral resection of the prostate. Before we talk about this procedure, let's review some information about the prostate and your medical condition. The prostate is located under the bladder and behind the penis. It is a walnut-sized gland that is part of the male reproductive system. It helps make semen. The urethra is a tube that carries both urine and semen to the penis. It passes through the prostate, which surrounds it like a donut. In some men, the prostate gland becomes enlarged and blocks the bladder by squeezing or growing into the urethra. BPH, or benign prostatic hyperplasia, is the most common reason for an enlarged prostate in men over 50. It is not cancer. BPH can cause a blockage called BOO, or bladder outlet obstruction. Symptoms of prostate enlargement are incomplete bladder emptying, or being unable to empty your bladder all of the way. Frequency, the need to urinate often. Intermittency, starting and stopping several times with urination. Urgency, feeling strongly that you have to go. Urine stream that is weak or dribbling. Straining to empty your bladder. And nocturia, urinating frequently at night. Now let's talk about the TURP procedure. A surgeon uses an instrument with a light and camera called a scope. It has a loop at the tip that can cut with heat energy. The loop is guided by your surgeon to remove prostate tissue that has grown inward to compress or block the urethra. This procedure is intended to relieve your symptoms by removing the blockage. Tissue removed from the prostate is sent to a lab for testing. Now let's talk a little more about what happens during a TURP. Before starting the TURP, you are given general anesthesia to make you sleep and keep you free of pain during the procedure. You are positioned carefully. An instrument with a light and a camera, called the scope, is then gently inserted into the urethra. A numbing gel is used to help the scope glide easily. The surgeon uses the scope to reach the prostate and see the prostate tissue causing the blockage. The surgeon uses the loop through the scope to remove extra prostate tissue in small strips, clearing the blockage. The same loop is used to burn and stop any bleeding that is seen. When the surgery is complete, the scope is removed. Your surgeon will place a Foley catheter to help drain your urine for a few days. A Foley catheter is a thin tube inserted through your urethra and into your bladder. The tube will keep your bladder empty to allow you to heal and feel more comfortable. The Foley is easily removed a few days after the procedure. The balloon is deflated and the tube simply slides out. Because tissue is removed with a TURP, some bleeding does occur. A small percentage of patients have complications due to blood loss during or after the procedure. An advantage of a TURP is the prostate tissue is sent to a lab to be tested for cancer. New procedures for BPH use laser, microwave, or other energy sources that vaporize or destroy the prostate tissue. They tend to have less bleeding, but nothing is removed, so no testing is possible. You can expect to stay 1 to 3 nights in the hospital after a TURP. The Foley is usually removed before discharge. After After prostate surgery, some men will feel better quickly. Often, it can take much longer. There will be some blood in your urine right after surgery, and you will have some pain. It may take a few days or weeks until you can urinate without pain or difficulty. Urinary retention and urinary tract infection can happen. Call your doctor if you cannot urinate, have a fever, worsening pain, or bright red bleeding that doesn't stop. Scarring to delicate nerves and tissue can cause lasting changes after TURP, including erectile dysfunction. 2% or 2 in 100 men will have ED or some trouble with their erections after a TURP. Incontinence or leaking urine for 10% or 10 in 100 men. And most men will notice less semen or may have a dry ejaculation. To avoid cancellation or complications from anesthesia or your procedure, your job as the patient is to not eat or drink anything after midnight, the night before surgery, not even a stick of gum. Take only medications you were told to on the morning of the surgery with a sip of water. Ask when to stop your aspirin or blood thinners before surgery. Arrive on time and have a support person available. You should be ready to verify or confirm your list of medical problems and surgeries. All of your medications, including vitamins and supplements, current smoking, alcohol, and drug use, and all allergies, especially to medications, latex, and tape. Let your nurse, doctor, and care team know if you are having unexpected pain, dizziness, or trouble breathing. Be sure that you understand why this procedure has been recommended for you. This is considered major surgery, even though you may go home the same day. All surgery and anesthesia have a small risk of serious injury or death. If you have questions about this procedure or need further information about alternatives, ask your surgeon. This video is intended as a tool to help you better understand this procedure. It is not intended to replace any discussion with or recommendations by your surgeon.